Why you can't afford to be an IVF dummy. I talk to many patients who have failed IVF cycles, and I am dismayed and perplexed by how little they actually understand about the IVF process, even though they are intelligent and highly educated professionals. They don't seem to have a clue about how many follicles they grew, how many eggs the doctor collected, how many embryos were transferred, or the quality of the embryos. This is partly because IVF specialists refuse to share information with their patients. They want their patients to put them on a pedestal, and they keep their patients on their knees by telling them, "Just leave everything up to me, because I am the IVF expert, and I will do what is required." They treat their patients like dummies, because it's much more convenient for them when patients blindly obey the doctor's orders. In fact, these IVF doctors discourage patients from doing Google searches or finding out information for themselves. They tell patients that IVF is extremely complex, and that a doctor needs 10 years of training in order to master IVF, which means it's just impossible for a patient to make head or tail of such a complicated medical treatment process. Many patients get lost when trying to do a Google search to learn more about IVF, because there is so much misinformation out there, and it's not easy to judge which information is reliable and which is not. However, if you don't know enough about IVF, it is very easy for bad doctors to exploit you. IVF doctors know infertile patients are gullible and desperate, which is why it's so easy to cheat them. However, you cannot afford to remain a dummy when you are doing IVF. You need to do your homework, both before starting the IVF cycle and during the IVF treatment, so you can ask the right questions and get the right information. Medical treatment is too important to leave everything up to the doctor, and good doctors will actually encourage you to find out as much information as possible for yourself, because they want you to have realistic expectations of what you can do for them. They know that the more you know about IVF, the lesser will be your stress levels, and the happier you will be with the quality of care they give you. On the other hand, if you are completely clueless about IVF, you will not know whether the care has been good or bad, and if the IVF cycle fails because the doctor was bad, you will deprive yourself of your best chance of having a baby. Knowledge is power, and ignorance is not bliss, so please arm yourself with information therapy before starting an IVF cycle. Subscribe to our YouTube channel.